I'm Rick Buck and I've been a dentist for 15 years. In this video, we will go over most of the possibilities as to why teeth and gums ache and throb on their own. Even when pain feels like it's just happening spontaneously on its own, there actually is a trigger, and we're gonna go over many of the possibilities for that and teeth pain in this video. When talking about any pain, we talk about the different possible mechanisms or pathways of the pain. Then after we've narrowed that down, we go over all the possible remedies to all the causes that might be causing your pain. And we're gonna go over many of the possibilities for that and teeth pain in this video. Here are the two things you need to know about toothaches and throbbing that seemingly happen with no trigger at all. I say seemingly because most of the time there actually is a trigger that is causing your pain, and it's just hard to identify for a lot of people. So here are some things you want to know to help narrow down your pain. Is there a specific time the pain comes? At night? After a meal? When laying down? Are some of the more common ones that you might find. Also, you want to know if you can pinpoint where the pain is and if there's anything like cold or biting that further aggravates the pain as well. Now, if you do have a little bit of cold or biting pain in addition to the tooth just aching on its own, you're gonna want to watch my videos on those to get further clarification on your pain. Let's talk about the tooth pain mechanism called pulpitis. Pulpitis is the inflammation of the pulp chamber in the center of your tooth, and this is where the nerve system for your tooth lies. This increased inflammation in the center of the tooth changes how those nerves react, and it makes them more excitable or easily triggered to any sort of stimulus. Normally, pulpitis causes pain, especially when cold touches the tooth. Even a normal amount of cold that wouldn't normally cause pain. Now that's what normally happens with pulpitis. However, the tooth oftentimes will just ache on its own due to the increased inflammation, and there won't be any cold pain along with it. So this will feel like it's spontaneous pain in your tooth. Even if there isn't obvious cold pain, we as dentists still test it out with cold because so often people won't realize they are sensitive to cold as well because they're so focused on that intense spontaneous pain and throbbing. If there is no cold sensitivity, then we move on to other possibilities, as we will just in a moment in this video. Okay, let me break down pulpitis for just a moment before we move on to some of the other possible causes of your spontaneous tooth pain. If there is cold sensitivity of short duration, normally less than 10 seconds, then pulpitis is said to be possibly reversible, meaning the tooth may possibly heal itself and the pulpitis will go away and back to being normal eventually. However, teeth are not as good as other parts of your body at healing themselves. So sometimes the pulpitis won't heal at all and it'll get worse until it dies, which then turns into a breeding ground for bacteria and infection in the center of your tooth. If the tooth is on this path to dying and getting an infection, we say the tooth has irreversible pulpitis, and we can pretty much tell if it's on that path. We determine if a tooth has irreversible pulpitis if the cold sensitivity test lasts longer than about 10 seconds. Now, there are other possible tests to this. A dentist can also determine with a pulp vitality tester if the tooth is irreversible, reversible, or alive and well. Here is one thing to note though about reversible pulpitis. Anytime you get reversible pulpitis, it can possibly turn into irreversible pulpitis. Now, in just a moment, I will tell you what I have my patients do that normally prevents the progression into irreversible pulpitis. But what causes pulpitis or inflammation? Lots of things. Cavities, trauma to the tooth, clenching, and having dental work done are just a few of the possibilities that might cause tooth inflammation in the center of the tooth, otherwise known as pulpitis. The main thing you want to know here is that the tooth is trying to get better, and what we want to do is help it get better. Here's what I have a lot of my patients do. I have them take over-the-counter ibuprofen 3 times a day for about 3 to 4 days if they're able to do that. I just have them take whatever the bottle recommends, which is normally about 400 milligrams. Now, this ibuprofen actually isn't for the pain. Ibuprofen can reduce inflammation if the inflammation becomes too much for the tooth to handle. So that is why you're taking ibuprofen. I have seen this greatly reduce the chances of reversible pulpitis progressing into irreversible pulpitis. And why you don't want it is because if you have irreversible pulpitis, this means you will eventually need a root canal treatment to save the tooth. Now, root canals aren't that bad, but they are costly, so you really want to avoid having them. If my patient can't take ibuprofen, there are other anti-inflammatories that I can prescribe as a dentist. Or a lot of the times they can take Prilosec OTC, or other words known as omeprazole, and they can take that before they take the ibuprofen, which will calm the stomach down so they're able to handle the ibuprofen. Check with your doctor for your individual needs if you want to know more on this. Now, moving on from pulpitis, the next pathway for which you may be having a spontaneous toothache or throbbing is what we call a tooth infection. An infection of the tooth can be felt within the tooth itself or around the tooth. Either way, an infection can cause a feeling of spontaneous pain or aching. And what's funny is the pulpitis we just covered will sometimes lead to this, as I already told you in the previous section. Why is this happening? Like pulpitis, an infection can also cause pain due to increased pressure or by just irritating the tissue in contact with the infection. What is interesting about pulpitis and an infection is that both can be triggered by laying down, because laying down will increase the pressures of fluids to your head, and this means more pressure in the site of the infection that you're having. So while it may seem to you that you're randomly having a toothache, it may actually be from lying down, because that causes the pain to intensify and the throbbing to intensify with both pulpitis and a dental infection. If this happens to you, it may be best to sleep with your head propped up until you can get in to see your dentist. Ultimately, a dental infection can only be treated permanently by having a root canal or having the tooth taken out, and then you can have it replaced by a dental prosthetic like an implant. But the infection is not going to go away on its own. Antibiotics are only a temporary treatment, and if the tooth is not permanently treated, the infection will return and likely get resistant to the antibiotic if you take it and still don't have treatment afterwards. So be careful about just taking antibiotics and not having the treatment, because the antibiotics cannot reach the center of the tooth because the tooth is dead and it has no blood supply. So it is just a breeding ground, and while the antibiotics may take care of the pain and some of the infection temporarily, ultimately it will come back, and next time it will probably be more resistant to whatever antibiotic you've taken. Now, how did you get this dental infection? What likely happened is you either had a cavity that reached the center pulp chamber of the tooth and caused an infection, which ultimately, once again, kills the blood supply to the tooth so you can no longer fight the infection. And then once that infection has stayed in the tooth, the infection starts to spread to the surrounding tissue to create a pocket of infection called an abscess. There are a few other scenarios to why you may have had a tooth infection, but this is the main one. Something like trauma is also another possibility. Speaking of fillings and cavities, and before I go on to other causes, you need to watch my best daily brushing and flossing routine video. It will show you how to optimally take care of your teeth with all the best products that I have tested out in other videos on my channel. These products include my favorite floss, toothbrush, and toothpaste by far, but you can see why they are my favorite with stunning results in a video that I will post at the end of this video that gives you the best technique to take care of your teeth. Now let's talk about toothaches that throb on their own, which are caused by inflamed ligaments. You see, your teeth are anchored to your jawbones by tiny little ligaments. Those ligaments can become stretched, bruised, and inflamed. The pain can be quite intense, or also the pain can be very subtle. So what I'm saying is the pain on the pain intensity scale could be anywhere. Now, apart from the intensity, the quality of the pain can also vary quite a bit. You see, it can just be an aching on its own, or also it can be triggered by biting down on the tooth. So let's go over what causes the tooth ligaments to become sore. First is clenching and grinding. You see, most people clench and grind their teeth at night when they sleep, but it can happen in the day too. Some people do it more than others, and you will do it at certain points in your life more than at other times. Most people don't even realize they're doing it in the day, let alone at nighttime. And what's interesting is clenching some kind can actually temporarily make the clenching pain feel better. Thus, it creates this vicious cycle where you clench to stop the pain, but then more inflammation sets in and causes more pain, and then clenching down makes it feel a little better, and so on and so forth. Now let's go over some of the ways you might be able to tell if it's tooth ligament pain. You see, most of the time people get inflamed ligaments due to clenching. The people find it difficult to locate where the pain is. And the reason for this is because when they start clenching more, this excessive pressure is distributed on many teeth. And so it's kind of hard to tell where the ligaments are at in the first place, let alone distributed among many teeth. For some people, it isn't distributed among many teeth and it's just 1 or 2 teeth, and that makes the pain a little bit more easy to locate. But when you think about it, any excessive pressure on your top teeth will also likely put pressure on the teeth below it, so they won't even be able to locate whether it's on the top or the bottom sometimes. Also, one thing I find with people that have a lot of tooth ligament pain due to clenching and grinding is that the pain will normally coincide with a nighttime or morning soreness almost on a routine, depending on how your body responds to the clenching and grinding. Also, what helps give away the tooth pain is a lot of times people will say this pain comes and goes for a day or a week at a time, and then will go away for a day or a week or a month and then come back again. If you have inflamed ligaments due to grinding and clenching, I have a full video on this, but here's what I have my patients do if they have clenching and grinding issues. I start off by having them just give it a little time and see if it goes away on its own. Ibuprofen will normally help to reduce the inflammation in the meantime. Then there are a few things that we can do to pinpoint what exactly is the root cause or main thing triggering the excessive clenching, because once you get that to stop, your pain should just go away. One of the most common things that people think causes tooth pain due to clenching is stress. But I have found that to be one of the causes, but not the main cause. I actually see so many people taking over-the-counter vitamins, and these seem to be one of the main culprits for clenching and excessive clenching in people's lives. The main vitamins and minerals seem to be vitamin D, calcium, and metals like zinc and iron. If these are not doctor prescribed, then I have my patient go on a 2-week hiatus of all vitamins and see if this resolves their clenching pain. And I have seen this work for about half of the time for people that both are taking vitamins and have jaw pain. Not everyone taking vitamins and not everyone with jaw pains, but about half the time for people taking vitamins that already have jaw pain. Even if they have been taking vitamins for a long time and this has been a recent issue, I still have seen it routinely be the cause, and it goes away after they stop. People change, and sometimes vitamins just all of a sudden are too much for someone when they weren't before. Like vitamins, medications are another common issue that cause excessive clenching. I would ask your doctor about your meds. Sometimes they can cause clenching, and there are alternatives or lower dosages that they can try, but always ask your doctor first. The next possibility are hard pillows and bad sleeping positions. Sometimes when you sleep in an unfavorable position, it will tire out and make sore the muscles around your neck and back. Then what happens is your jaw actually tries to compensate for the fatigue in the other muscles. This eventually fatigues your jaw muscles as well and makes them sore. And so everything in this area just starts kind of feeling sore. This can be especially true for people that use hard or memory foam pillows, but honestly, it can happen to anyone in a sleeping position that isn't favorable, so I would just try changing pillows or sleeping positions for a couple weeks. Now, like I mentioned, stress also causes clenching, so reduce that however you can, but I wouldn't think necessarily that just because you're clenching a lot, it is stress, because that's what a lot of people think. Also, extreme workouts and diets can cause clenching, likely due to some sort of imbalance in your hormones in the body. Now, these are just a short list of things that you can try. And once you have tried those, if they don't apply to you and the pain persists, then there are a few interventions we as dentists can do. Most dentists can make night guards to eventually distribute the pressure of your clenching more evenly when you sleep at night. And night guards are just something that fit over your teeth. Or another alternative that dentists can do is deliver botulinum toxin or Botox to the jaw muscles, and this reduces the amount of involuntary clenching and excessive clenching. In fact, I have found this reduces pain from clenching more consistently than even night guards. One more note. If clenching pain is limited to just 1 or 2 teeth, sometimes we as dentists can slightly file those teeth down just a few microns to reduce their pressure, and this gives them relief, and ultimately they're able to heal from the tooth ligament pain. Aside from clenching, food impaction or getting food caught in the teeth can cause inflamed ligaments and gum pain. Now, this feels like it's spontaneous because sometimes when you get the food caught in your teeth is not when the pain starts, but it will start actually a little bit later. Now, you can differentiate this pain from the others because normally it's a little more intense and localized, meaning it's easier to pinpoint where it's at. In fact, for most people, the pain actually is most intense when they're eating, but for some people, the pain starts to increase moments, minutes, hours after eating. Popcorn husks are a big culprit for this kind of food impaction pain. Now, food impaction is very common for people who have adjacent teeth that don't contact each other tightly or don't contact each other at all. The best remedy to this is to remove the debris with floss. Anyway, what you want to do with the floss if you're getting a lot of debris caught in your teeth is tie knots in the floss and then thread it back and forth until the food or debris comes out. I have a video more about that too. Ultimately, if you have a gap in the teeth causing a lot of food impaction, a dentist can do a filling or a crown to tighten the space and minimize the amount of food impaction you're having. Now we're done with tooth ligament pain. Let's go on to gum disease, also known as gingivitis or periodontitis, because this is another pathway of spontaneous throbbing teeth. In gum disease, there's a pocket that forms between your tooth and your gums, and this is filled with very unhealthy bacteria that is located in the plaque and tartar that builds up around your teeth. This bacteria eats at the gums, the bones, and the ligaments that hold your tooth into place, which causes easy bleeding and aching in your gums. If you've noticed that your gums are bleeding easily, like when flossing, this can be a sign that you actually have some stage of gum disease. The main causes of gum disease are mostly sugars and our modern diet mixed with insufficient oral hygiene. There was this interesting study. They were put on this ancient diet where they didn't have refined sugars and all the carbs and everything that we eat today. And when they were put on that diet, after days and weeks, all of a sudden, all the indicators of gum disease, like bleeding gums, started to improve. And they still even had poor oral hygiene because they didn't have all the tools to have great oral hygiene that we have today. Anyway, this goes to show that the biggest culprit for our gum disease is mainly sugars and our modern diet. Well, that may help to know for the future, but now let's go on to what you can do for your gums if you have gum disease right now. The treatment for gum disease, if it hasn't progressed too far, is a deep cleaning. Any home care without a deep cleaning won't be sufficient until a deep cleaning is done. But obviously still do good home care, it just won't be enough and effective to get rid of gum disease until you have the deep cleaning. Antibiotics, once again, can be a temporary fix, but the source of the infection is the tartar and calculus stuck to your teeth like barnacles, and all the bacteria, once the antibiotics are gone, will just come right back. Now, another thing that you see from time to time as a dentist, though it's not as common as some of the other things for spontaneous pain in the teeth, is a phenomenon called phantom or referred pain. Basically, our nervous system is quite complex. You can feel pains in parts of your body that aren't actually where the pain is originating. In other words, you might have a soreness originating from one spot, but your brain perceives the pain as manifesting in another spot. The teeth are definitely no different than anywhere else in your body. Oftentimes, the phantom pain results in a seemingly spontaneous or aching in your teeth themselves. For example, if you have jaw muscle pain, sometimes your brain will interpret that pain as pain in your teeth. This diagram shows you which muscles are most commonly associated with phantom pain in the certain teeth that they affect. Now, sometimes if you press on those muscles, you can even feel the pain in your teeth, sometimes if you're lucky. And just like muscles can refer pain, there can also be phantom pain originating from inflammation in your jaw joint. There are many important nerves near your jaw joint, and sometimes pain originating there will be felt in your teeth or in your jawbone. Okay, moving on. Like phantom pain, you have sinus issues that can be felt in your teeth as well. If you looked in the floor of one of your sinuses, you would see these little bumps on the floor of the sinus. These are the roots of your teeth butting up against the floor of your sinus. When some people get sinus infections or allergies, the pressure can be translated and felt in some of your upper molars as well. And the next thing fitting into this category of phantom and referred pain is just referred pain itself. You can have pain originating in one tooth and you just feel it in another tooth for some reason. This will happen a lot of times on the back two teeth in your mouth. Now, this all may have sounded really confusing, and I broke it down as easy as possible, but trust me, it is confusing. You want a methodical dentist to look at your pain. I've seen people do root canals and pull out teeth that they ultimately discover were having referred pain. Interestingly enough, phantom pain normally manifests itself the best once you've done something like pull out a tooth and you still have pain in that tooth even when it's gone. Thus it gets its name, phantom pain. If you have phantom pain, a dentist will need to find the actual cause of pain to treat the issue. Sometimes decongestants, ibuprofen, muscle relaxers will give some temporary relief. Everyone should watch my daily tooth care routine I have posted now, and I will show you why in that video it's the best technique and products to get the best daily spotless cleaning. Now, this video is part of a larger series of oral pain I'm doing. That way you can further narrow down and find the cause of your pain and hopefully find a remedy or see a dentist that can provide you an official diagnosis and treatment. If in Southern California, my dental office is linked to below. Like and subscribe if you have teeth.